Recently, cases of Lassa fever disease have been reported both in northern and southern part of Nigeria. The disease has been discovered in about 7 states across the country, and up to 150 people have been estimated to have contracted the disease. The BBC news agency reports that roughly 26 people have been suspected to have died of the dreaded disease in the recent outbreak. Past outbreaks include incidents reported on March 22, 2012, where 623 persons were suspected of carrying the virus, which resulted in deaths of 70 persons in 19 states across the country. In the same year, a laboratory analysis was carried out at the Irua Specialist Teaching Hospital in Edo State, which confirmed infections in 108 patients. Also, on May 25, 2015, the case of a traveler returning on a journey from Liberia to the United States was also reported, and the list goes on. So what really is the Lassa fever disease? The Centers for Disease Control and Prevention described Lassa fever as an acute viral illness that occurs in West Africa. The organization reported the illness was discovered in 1969 when 2 missionary nurses died in Nigeria, and that virus was named after the town in Nigeria where the cases occurred. Aside Nigeria, the disease has been found in virtually all of the West African countries including Liberia, Sierra Leone, Mali, Guinea, Togo, Burkina Faso, Benin, and Ka. The host of the Lassa virus is the multimammate rat called Mastomus ateliosus, and is locally known as the African rat. This rat species can be identified by its many breasts, and lives in bushes and surroundings of residential areas. According to the World Health Organization, WHO, the virus is transmitted to humans through direct contact with rats carrying the virus or by coming in contacts with food or household items that has been contaminated with the rodent's excreta. Human-to-human infections also occurs in laboratories and hospital environments where infection prevention and control measures are lacking. It takes up to 21 days for the virus to incubate in a human host's body. In about 80% of cases, infected persons show no symptom, while the remaining show severe multisystem disease, whereby the virus affects several organs in the body, such as the liver, spleen and kidneys. After infection, progression of the disease is gradual. It may start with combination of fever, fatigue, headache, sore throat, muscle pain, chest pain, and gradually progress to vomiting, diarrhea, cough, and eventually bleeding of internal organs, under the skin or out of body orifices. More worrying is the fact that some infected persons may suffer permanent loss of hearing after recovery, and it might lead to death in serious cases. Overall fatality rate for the disease has been put at between 1% and 15% for severe cases of the disease. Treatment and vaccines. There is currently no vaccine that protects against Lassa fever. An antiviral drug known as Ribavirin may be an effective treatment for Lassa fever where administered at early stage of infection. However, there is currently no evidence that supports Ribavirin as a post-exposure treatment of Lassa fever. Early supportive care with rehydration and symptomatic treatment may improve chance of survival. What is Nigeria doing about recent outbreak? The Nigeria Federal Ministry of Health has embarked on deployment of the antiviral drug Ribavirin to affected states. Currently, surveillance, tracking and testing of infected persons is in progress to ascertain the level of infection while the outbreak has been reported to the World Health Organization. Prevention and control of Lassa fever. According to the World Health Organization, prevention of Lassa fever relies on promoting good community hygiene to discourage rodents from entering homes. Effective measures include storing grain and other foodstuffs in rodent-proof containers, disposing of garbage far from the home, maintaining clean households and keeping cats. Because rats are so abundant in endemic areas, it is not possible to completely eliminate them from the environment. Family members should always be careful to avoid contact with blood and body fluids while caring for sick persons. In healthcare settings, staff should always apply standard infection prevention and control precautions when caring for patients, regardless of their presumed diagnosis. These include basic hand hygiene, respiratory hygiene, use of personal protective equipment, to block splashes or other contact with infected materials, safe injection practices and safe burial practices. Health workers caring for patients with suspected or confirmed Lassa fever should apply extra infection control measures to prevent contact with the patient's blood and body fluids and contaminated surfaces or materials such as clothing and bedding. When in close contact, within 1 meter, of patients with Lassa fever, healthcare workers should wear face protection, a face shield or a medical mask and goggles, a clean, non-sterile long-sleeved gown, and gloves, sterile gloves for some procedures. Laboratory workers are also at risk. Samples taken from humans and animals for investigation of Lassa virus infection should be handled by trained staff and processed in suitably equipped laboratories. On rare occasions, travelers from areas where Lassa fever is endemic export the disease to other countries. The diagnosis of Lassa fever should be considered in febrile patients returning from West Africa, especially if they have had exposures in rural areas or hospitals in countries where Lassa fever is known to be endemic. Healthcare workers seeing a patient suspected to have Lassa fever should immediately contact local and national experts for advice and to arrange for laboratory testing. The Nigeria Federal Ministry of Health had confirmed the country currently have the capacity to deal with the infection, and had already embarked on mass sensitization program. The country has not placed any travel restrictions as the outbreak is under control.